Don't you hate it when a patient comes in and gets that introductory exam and cleaning and you tell them they need a filling or a crown only to never hear from them again? When we come back, I want to tell you how you're doing the same thing to your dental prospects. Stay tuned. Colin here on Friday, March 20th. Many dentists don't realize that they're just like the patients who drive them crazy but not coming in for the follow-up visits. For instance, if a prospect calls your office, are they guaranteed to speak to someone? Or do callers sometimes fall through the cracks? Do you have a new patient hotline number so that you know who's a new prospect and who's an existing patient? Do you track where the prospects who do call you heard from you? Follow-up is one of the biggest problems that I see when I talk to dentists across the country. The problem usually lies in one of two areas. First off, there's too little follow-up. This means that office staffs aren't asking for phone numbers and email addresses when someone calls. And even if they are, the staff usually has to manually follow up with any prospects that they need to reach out to using a calendar or Excel spreadsheet or manually typing out an email or printing a letter or making a phone call. And this is not a good way to stay in front of someone who's at least shown some interest. And secondly, follow-up is haphazard at best. Every dentist I talk to tells me one of two things about how they know where new patients come from. Either A, we don't, or B, we ask the patients. And obviously, if you don't know where new patients are coming from, it's awfully hard to know which marketing message are working and, more importantly, which are not. But asking patients isn't much better. I did a dental podcast back in October on this exact topic. And to summarize, people's memories are notoriously bad. And the dentists who rely on patients to tell them where they first heard about the dentist are likely getting bad intel. And the discrepancy, the disparity between the accuracy of the information they get is directly proportional to how many different marketing campaigns or channels that dentist is marketing in. This is why we're such big fans of automated follow-up. And specifically, we use and endorse Infusionsoft. It's such a robust system, and it makes lead tracking and follow-up literally a snap. We also use call tracking that uses different phone numbers to differentiate different marketing streams. And that way, there's no question where a lead came from. All of this and more is contained in my latest book, Attract More Patients in the Next 6 Months Than in the Last 6 Years. This book is the culmination of all of my marketing expertise, and it can be yours for just $4.97, the cost of shipping. To get your copy while supplies last, go to moreandbetterpatients.com. I hope you found this series insightful and helpful. Have a great weekend, and as always, keep moving forward.